So today I'm going to teach you how to use the NavaClick mapping system to make your transition from your traditional injection technique to the NavaClick technique easier. We're going to map my face today. So I have my patient make an angry face, and as you can see, I have some vertical lines on the forehead. These come from the lateral tail of the corrugators way over here, so I need to make sure that I'm going to treat these in both sites. Not so much movement here. My main movement is from lateral. Then I'm going to raise my eyebrows, and I'm going to see my highest point of elevation in each side. And I'm going to take note that I've asked myself what is the problem with my forehead, and if I have too much paralysis of the forehead, I get a really heavy brow. They give me that feedback, and then I use that to govern my depth of injection. Then I'm going to have them smile, and I'm going to see where their crow's feet are, how aggressive their depressors are, so that I can tailor that into my treatment plan. And then when they smile, I'll also look and see if they have bunny lines, and I can recommend there, or even the jelly roll under the eyes that can also be treated. All these things are analyzed when I have the patient do the movement. I recommend for the first 5 to 6 patients, you do this mapping every single time, and it will help your mind catch on thinking clicks instead of units, and instead of guessing how much you're putting in, you're putting exact amounts in. So we're going to map my face based on what you saw in the previous video. So I have these vertical lines here, so I'm going to focus on my corrugator tails because the strength of my depressors come lateral. So I'm actually going to put 3 units on each lateral tail, spread apart, and I will mark that before I inject it so I know exactly where I'm putting it. And then my corrugators, I'm going to do a 3, a 3, and a 3. And I'm not counting units right now. I'm counting Botox units right now. I'm not counting clicks. And then I'm going to put 1 in each bunny line. Okay, so that's my map of the glabella and the nasalis. So my forehead, I know, and my patient told me that they get heavy brow if they paralyze the forehead too much. So in that situation, I'm going to accept the fact that I'm going to have some movement, and I'll tell the patient that. And I'm going to put 2 in the dermis here, 1 in the dermis, 1 in the dermis, 1 in the dermis. And then I'm going to do 1 here, very superficial, because I get a crease right here if it's not done at all. Same thing on this side because I'm very symmetric. 1 dermal, 2 dermal, 1 dermal, 1 dermal. And to go back here, these are all superficial, and I will do 1 superficial here as well. These are all muscle. And this is technically dermal because the dermis and the muscle are directly attached. Now you saw my photos, and I have a lot of depressor muscles, so I'm actually going to do 1, 2, 3 in each of my higher depressors. Okay, then I'm going to do 2 units in the heavy crow's feet here, and then I'm going to go 1, 2, 1 in the jelly roll, 1, 2, 1 in the jelly roll, and then I'm going to actually do a superficial out here to where I have those extended crow's feet that extend. Now these are all dermal. This is a superficial, and I will chart that in the computer that way, which I'll show you in a few minutes. Now, I haven't added any of this up. I don't even know how many units I'm going to end up with, so I'm going to add it up and tell the patient what I think they need. So 3, 6, 9, 12, 13, 14, 15 in the glabella, and that's the number of clicks. Then I'm going to do 2 in the nasalis. I'm going to do 1, 2, 3, 4, 5, 6, 7, 8 in 9. Wait, 1, 2, 3, 4, 5, 6, 7, 8, 9 on each of the crows. So that's 18 in the crows. And then I'm going to do 2, 3, 4, 5, 6 on each frontalis. Wait a minute. Yeah. So that's 12 in the frontalis. So then I'm going to add that up. 47 units. and I've got my map planned. I take this, I put it right beside the patient, I draw up my 47 units, and I proceed. Now the great thing about this is now that we're charting in Botox units, and we have 3 different syringe types based on your dilution. If you have a 1 cc dilution, we can create 1 unit per click. If you have a 2 cc dilution, you can create 1 unit per click. If you have a 2.5 cc dilution, 1 unit per click. That makes your Botox unit equivalent to your click units. Part of the reason I'm doing these videos today is to assure you how important the documentation and the preparatory plan for neurotoxin is when you're treating a patient, especially when you're going from a technique that you're used to and very common to a new technique that is very accurate. So it's very important for you to chart it and know what you're going to do, because you're not guessing anymore. You're delivering exactly 1 unit per click in each of the areas that you want to deliver it. When you go from an old technique to a new technique, it is important for you to get the feel of it and not just the mental capacity. So those 2 things go together. This will help you delete the mental thought process and just focus on your delivery, and then you can count by clicks and not have to even think about the units because you've already mapped it out. Now, I'm not saying you're going to need to do this every time, but this charting is going to allow you to have exact treatment plans. So if patients need something adjusted, you can go by this and you can adjust it by 1 or 2 units to make them happy. Now, I know some of you are going to say, well, that takes me more time. Well, I'm going to tell you, as a 32-year-old veteran in aesthetic medicine, plastic surgery, and now just aesthetic medicine, that extra few minutes you spend with that patient will solidify them in your practice for eternity. Patients want to know they're being listened to, and they want to know that you have thought the process out, not just cookbook them like everybody else. Can't tell you how many times I see a new patient that's had a bad experience a couple years ago and hasn't done a toxin since. They come to me, we do this map together, I listen to what they tell me, and I will have them forever. They will be my patient forever, and everything in our office is available to them, and I can promise you they will stay with us and they will do other procedures with us. Neurotoxin is the gateway to your aesthetic practice. It's the beginning. It's how they introduce themselves to you, and you introduce yourself to them. So use this to get your patient's attention and confidence, and make it simple for you, because it will pay off immensely in the long run. But I am not always here, and so if one of my injectors comes behind me to treat a patient, I want them to know exactly where we put it and what level we put it in. So I'm going to chart what I did for myself earlier, and we know we used 12 units in the frontalis. We used 15 units in the glabella, and those are 15 clicks, 12 units. And if you're doing Dysport, you would do your clicks and then backtrack it to 3. So crow's feet, we did 18. And nasalis, we did 2 units. And that's our total of 47 clicks and 47 units. Then I go to the next charting system. That gives me my face, and I'm going to put these. Okay, so these are very superficial, and I did 3 of those here. 1, 2, 3, 4, 5, 6. I did 3 in the muscle, 3 in the muscle, 3 in the muscle, 1 in the dermis, 1 in the dermis. Now, I did some dermals on my forehead, so I'm going to just scoot right up there and do 1 dermal here, 1 dermal here, 1 dermal there, 1 dermal, 1 dermal, 1 dermal. Then I have 2 all of these in the dermis because I don't want my brow to drop. And then to keep that freaky little crease that comes over the brow a little bit, I'm going to go really superficial right here, but not enough to weaken the muscle significantly. All right, so the orbicularis, or the depressors, crow's feet, most of these are all dermal because that muscle is attached to the skin. So when you get in the dermis, you're actually touching the muscle. So I'm going to do 3 here because I have those creases that show that my depressor muscles are very strong. Then I'm going to do 2, 1 in the jelly roll, 3, 2, 1 in the jelly roll, and then I'm going to do 2 in the dermis here, which I charted on my face sheet here, and then 1 superficial laterally in those extended crow's feet to try to soften that a little bit. So then I go back so that I don't have to think about it next time, and I put how many I put on each area. So that's 12, and I'm going to put a little red 12 right there. So when I'm looking, I don't have to think about it next time I'm there. I did 15 in the glabella, so I do a 15 right there. And then I do a 9 on each of my crow's feet, 9, 9, and then a 2 in the nasalis, or bunny lines, right there. And then my charting is complete. It tells my other practitioners what I've done exactly. They should be able to follow this without any issues. It tells me what I did. If I like that, I can repeat it. If I don't like it, I can tweak it in any way I need to. I hope that helps. I cannot encourage you enough to use this system. Remember that our 3 different syringes are available. Pink is not quite available yet, but it will be. The 2.5 and the 2 are available already, that you can get 1 unit per click.